In the midst of a global pandemic, nurses around the country have gone through extraordinary lengths to care for patients and save lives. With many of these stories now viral, we've set out to uncover the nurses behind them. I'm Nurse Blake, and this is Notable Nurses. Before we get into it, I want to give a special shout out to Verizon for sponsoring the series as part of their commitment to giving more to those who give the most. To see how their commitment extends to nurses and their families, check out the link in the description. Today's special guest nurse decided to use her creativity to solve a complicated issue in a really simple way. Let's check out her story.
I'm Jeanna, and I'm a registered nurse working in the emergency room at Lowell General Hospital. This past spring, our hospital, as many others were forced to implement a no visitor policy that was very strict and forced patients to be alone in the hospital when they were scared and sick. So I bought a photo printer and I set up an email and I shared my plan to print and deliver pictures to patients from their families and friends. And through that, Pictures for Patients was born.
Hey Nurse Jeanna, it's so nice to finally meet you.
So nice to meet you too. It was so exciting.
I heard about your story and I'm like, I have got to talk to you.
That's so sweet. Thank you.
Can you tell us a little bit about how Pictures for Patients started and came to be?
Sure, yeah. So, kind of back in the spring at the beginning of everything, there was a day I had one of my most challenging COVID days, as I call them. I was with a patient for 5 hours in a room, didn't come out, and it ended up being an end-of-life situation for her, and she couldn't have family. And, I think experiencing that firsthand and being the person with her, it had no right to only be me. It should have been her family, and that really affected me. And the next day, I talked to an old friend from high school. I found out his father was in our ICU. I offered to pick up pictures, thinking it might be a nice thing to get into his father, and hearing how relieved they were to have some way of connecting, I just realized it was something that could really be bigger, and I shared it, and it really kind of went crazy on the internet. Very unexpected still. I can't believe it.
Can you tell me, do you have one experience that stands out?
One of my favorite, most uplifting ones was sharing a pregnancy announcement for a couple who had been having a lot of trouble getting pregnant, and their uncle was hospitalized, who they're very close with. And so I was actually able to print out their pregnancy announcement and deliver it to his room. And it was so special to, be the liaison in this family. I don't know them. And here I am, the one sharing the pregnancy announcement. And another that stood out is, not as uplifting, but a family who sent pictures and I delivered them that day, and she passed away the next day. And as sad as that is, it was something that was coming, and they felt that her having the pictures of the family really allowed her to let go. And it meant so much to them that they actually buried her with the photos I printed. I couldn't believe that this project was having an impact like that on people.
Well, I'm so happy that you were able to come up with this innovation and really being creative, and really something that someone would think is so simple, but yet makes such a huge and positive impact in the lives of not only the patients you're caring for, but also the families. So can you tell us a little bit about how the process starts?
It's actually really quite simple. It's literally just Pictures for Patients at our hospital, and families email me the pictures. I print them here and I just put them in an envelope and bring them up. Usually it's the nurses up on the floors that deliver them for me.
I did notice that you said you did it you came in on your days off. Are you doing a lot of the work on your days off?
Yes, all of it. Actually, I made it a point to not set up at the hospital because, especially in the beginning, there was a lot of downtime. I needed something to keep me busy in a positive way, and this turned into something good for me. Even days I wasn't working, I was taking 1 or 2 trips to the hospital to deliver pictures.
Well, I'm glad you made it happen. I know that, this time has caused a lot of burnout, but it's so cool to be able to connect and share stories like these with other nurses, because I think it's stories like yours that definitely just will help reignite the fire and flame, and why we all got into nursing in the first place. I became a nurse so I could have an impact.
Because it's easy to develop a layer of like cynicism almost.
100%, especially because we're tasked with so many things. The healthcare profession in nursing, they want to so much focus on the science that we forget about the art of nursing, which is the connections.
And I think we almost take our profession for granted sometimes, but when you step back and think about it, especially being forced to in this moment, you really realize how important what we do can be.
I actually have a special guest who's going to be calling in. She heard about your story and she wants to thank you and share with you how your story inspires her in her line of work. She plays Dr. Lauren Bloom on NBC's New Amsterdam, introducing my friend, Janet Montgomery.
Hi, Jeanna. I'm so lucky to get to meet you. You're a huge star, and I am so impressed that whilst the pandemic was going on, most people, myself included, were running around like headless chickens, and you were being so creative, trying to find new ways that you could help people.
Oh, I appreciate that very much. I was also doing the same, trust me.
Well, you managed to find time to start this whole endeavor, and to me, it's such an incredible idea.
Thank you so much.
Okay, so you're a real frontline worker, and I just play one on TV. So my first question is, what do we all do wrong? What do you see when you're watching medical dramas, especially New Amsterdam? What's not believable?
Oh, the CPR. It's always so bad.
No, I felt like I was good at CPR. Oh, okay. Tell me.
Though, I have to say, I don't know how we would fix that because I think that you can't really do CPR on somebody unless they need it. So
yeah, I was
guess we can let it slide.
doing the presses and everything, but you can't do it too much, otherwise you'll break someone's ribs. So
I guess we can let it slide.
You're really supporting so many people. How can we support you?
Staying away from people as much as possible, and like that is the most helpful thing you can do for anybody working in the medical field right now, and we appreciate it more than they can even imagine.
Me and my family are absolutely going to do that because you are doing so much, you and all other healthcare workers around the world, not just America. So if all we have to do is socially distance and wear a mask, then yes, absolutely. And I hope everyone else will do as well. Bye, Jeanna. It was lovely to meet you. And I'm going to turn you back over to Nurse Blake.
That was so cool that Janet was able to come by. I hope that maybe the producers of New Amsterdam see that and maybe they'll cast us for the next season.
I think they should.
If a nurse or, another healthcare worker wants to be involved in your project, Pictures for Patients, how can they get involved?
Keep it simple. Get the printer, work with the hospital to get a secure email and do it. I have asked them to share the hashtag if they are sharing anything about it, only because it's felt really fun to see it kind of spread and grow. Take it, run with it, and just keep me posted.
I love it. I hope that this campaign just grows and grows and grows. Thank you so much, Nurse Jeanna, for your great work. Thanks for stopping by. Keep it up and stay safe.
Thank you so much.
That's it for today's episode. I'd really like to thank Nurse Jeanna and Janet for joining me. I also want to thank Verizon for sponsoring this series. Please check out the link in the description to find out more about Verizon's commitment to nurses and their families. And don't forget to like, comment, and subscribe to my channel. I'm Nurse Blake, and this has been Notable Nurses.